Good evening. Welcome to our Community Awareness Virtual Roundtable entitled A Path Forward. I'm Dr. Darrell Ezell, Director for Diversity, Equity, and Inclusion at HudsonAlpha Institute for Biotechnology in Huntsville, Alabama. The purpose of this two-part roundtable is to provide broad community awareness and education to North Alabama's minority population on the alarming impact of COVID-19 and to learn of current efforts to combat the spread of this deadly virus. We would like to acknowledge Mr. Elvin Jenkins as the Director of Electronic Media Communication and his staff at WJAB 90.9 FM. WJAB has partnered with us tonight to simulcast this roundtable live on the air. We appreciate your support. Thank you so much. Our topic for tonight will address COVID-19 variants and community engagement. To start us off, we would like to welcome HudsonAlpha's President and Science Director, Dr. Rick Myers, to provide opening remarks. Dr. Myers.
Thank you, Dr. Ezell. Great to see everyone. I see some old friends and new friends on the chat or the participant list there. It's great to see you all. First of all, thank you everyone for joining. This is a really important topic. I think most of you know, but in case you don't, HudsonAlpha Institute for Biotechnology is in Research Park in Huntsville, and we're a nonprofit research, teaching, and clinical enterprise. We do research and applications in the fields called genomics and genetics. And we've been here for 13 years. We do lots in human health and disease. We actually do a lot in agriculture and sustainable agriculture and things having to do with plants and animals. And a major portion of what we do is education outreach. You will hear a lot about that if you haven't already. Everything that we do, essentially this scientific research is to study the universe. We study the biological universe and what makes organisms work. And we're organisms, obviously, so we want to know what makes us work, as well as what makes crops and other things that are important to us work. And what happens when something goes wrong? That's where we really want to try to figure that out as well. So these tools of genomics and genetics are incredibly powerful, and they affect almost everything that we as a species do. That's everyone. And this is why inclusion is so important in every aspect of this. We do a lot of things to do our best for inclusion. We can always do better. We're really glad to have Dr. Ezell join us earlier, just in time for COVID, I guess, to help really build and expand our efforts. And we're doing, I think he's doing a wonderful job, and I think we're doing everything we can. You will hear about some of these. I'll just mention a few. We have a program called Information is Power, which is to make genetic screening, especially for breast and ovarian cancer, but for some other cancers as well, available to everybody. And we're reaching out to do this through, we've done it in our counties surrounding us, but we're reaching out to do it even broader than that. We look at the genetic information, the genomes of lots and lots and lots, thousands of children and adults with unexplained diseases, and actually have had a major impact in figuring out what causes those unexplained diseases and even being able to do something about it. There are many projects like that, and many of these affect some populations more than others. And certainly in African Americans, we see lupus, several other things where they're at higher rates, and we really want to try to figure that out, and then of course do something about it. And of course, everything got thrown for a loop a year ago when COVID came along. Thank goodness we have science to help get us out of this mess. And it is unbelievable that we have vaccines 10 months after started. It usually takes 10 years to develop a new vaccine. So this is really, really important. We need to be ready for the next one. And we ain't out of the woods yet on this one either. So it's really, really important that we do as much as we can. We did not stop our work on cancer and heart disease and autoimmune disease and neurological diseases and sustainable agriculture, but we did a big shift, and lots of us at HudsonAlpha and then in our associate companies, which you will hear more about, where we're doing a lot of things having to do with COVID. And you're going to hear about some of those tonight. A lot of testing to help to screen. We're screening the wastewater screening. We're doing looking at the new variants that are coming along. You'll hear about lots of these things. They're really, really important. So this is the first of two, as Daryl said, first of two of these roundtables. And we hope that you will not just join us for these, but join us for many others. We have lots and lots of events throughout the year. So welcome, everyone. Looking forward to hearing the talks tonight.
Thank you so much, Dr. Myers. Our panelists for this roundtable include, we have with us this evening, Dr. Neil Lamb. Dr. Lamb serves as the Vice President for Educational Outreach at HudsonAlpha Institute. We have Miss Daisy Price, who is the K-12 Student Experience Lead at HudsonAlpha. And we also have with us Dr. Tanya Perry. She serves as the professor and chairperson of the Department of Social Work, Psychology, and Counseling at Alabama A&M University in Huntsville, Alabama. I want to say thank you so much to our roundtable guest for this evening. Let's start it off with a little context. To date, we know that there are nearly 111 million COVID cases worldwide. 28 million of those cases are in the United States. 500,000 deaths related to COVID-19 here in the United States. Let's bring it home a little bit. 484,000 plus COVID cases in the state of Alabama. And there are over 9,500 plus deaths claimed by COVID-19 here in Alabama. Dr. Lamb, let's start off this evening. Thank you for being with us. Please kick the conversation off by helping us to better understand what is the novel coronavirus and variants, how is it contracted, and the role of a vaccine. What role can a vaccine really play in slowing the spread of this virus? Dr. Lamb.
Thank you, Dr. Ezell. Good evening, everyone. Thank you for joining us, both on the Zoom and through WJAB. It's great to have you listening with us tonight. I'm going to give us just a little bit of science, and I recognize that some of you may follow this very closely, and you may be able to give this presentation as well as I, and some of you, there may be some new information in here. But I think it makes sense to give everyone a baseline set of content about where we are, where we've been, and some of the opportunities and some of the challenges that are still ahead of us. So I'm going to share my screen, and then I will get us started. So just to bring everybody on the same page, COVID-19 is the disease caused by the infection with the coronavirus called SARS-CoV-2. It's a member of a broad family of coronaviruses, just like there are Smiths and there are Robinsons, and all of the members of the Smith family share some common characteristics and then have some differences. All of the members of the coronavirus family of viruses have some similarities. Many of them just cause a common cold. Some of them, like SARS-CoV-2, have the potential to cause a much more serious disease, the symptoms of COVID. One of the things that's so challenging about COVID-19 is that the symptoms range from no symptoms at all, so you don't even know that you have the virus, to incredibly ill, hospitalized, and as Daryl said, in America, over 500,000 deaths to date. We don't really understand why there's such a variation in symptoms, but in general, younger, healthier people have a lower risk of symptoms, and older individuals or those with pre-existing issues have a higher risk. This is a list on the screen from the Centers for Disease Control. Those of you that are listening by the radio, you can go to whatever your favorite search engine is, and you can simply type in CDC risk severe COVID, and you'll get the webpage that will give you this list. And it's divided into two categories. The left-hand side of the screen are those pre-existing conditions like currently dealing with cancer or heart failure or coronary artery disease or sickle cell disease, where we know that there is an increased risk that if you are infected with the virus, there's an increased risk you'll have serious symptoms. On the right-hand side of the screen are things like moderate to severe asthma or cystic fibrosis or thalassemia, where there's some evidence that there might be an increased risk, but we don't have a firm understanding of if it's definitely or not. But I put this on the screen because I want people to realize that we do have some understanding of who is at a higher risk, not just people that are older in their 60s, 70s, and 80s, but anybody that has one of these complicating risk factors. We don't always understand why those complications increase the risk of severe disease. That's part of the body of science that we're still trying to figure out. So let's move just quickly to how do I get COVID? So if you, like me, back in March and April, were wiping down your mail when it came in and cleaning your groceries and sanitizing your groceries when you brought them in from the store, or leaving things outdoors for a couple of days, fortunately, that is no longer thought to be a major risk factor. That concept of that the virus could live in packages or on clothes or in bags for a long period of time, there seems to be very little of the risk. So the prime driver seems to be that when someone is infected and when they cough or sneeze or yell or sing or laugh or even talk, they can be spreading droplets, respiratory droplets from their lungs and their throat and their nose out into the air. And these large droplets can contain the virus. And if that got on you and got into your nose or in your mouth, you could get infected. And then there are much smaller droplets that don't fall to the ground pretty quickly, but can actually stay aloft. They can stay in the air for longer periods of time. And that also seems to be another way that people can become infected. So this whole concept of respiratory droplets, big droplets that fall to the ground, small droplets that stay up longer, seems to be the primary way that COVID-19 is spread from one person to the next, which is why we do things like wear masks and stay 6 feet apart, and then try to stay away from crowded places or closed settings indoors or confined spaces, because those are all opportunities for, if someone else is infectious, to spread that to us, or if we ourselves don't know that we're infectious, we could potentially spread it to others. So these are things that you have heard for the last 11 months. And like me, you're probably tired of them and you look forward to the day when you can pack your mask away. We are not at that point yet. So I would encourage you just to keep doing those things. How is COVID-19 treated? So if you get if you're infected with the virus, and again, most people have a very mild case, they may be able to treat their sore throat or the fever with over-the-counter medicine. But some individuals have more severe symptoms and need stronger medication, need to be hospitalized. So there are some broad categories of medicines that have been developed and continue to be developed. Antivirals that slow the spread of the virus in your body to try to slow how quickly it moves from cell to cell. There are antibody therapies, either monoclonal antibodies or the plasma from individuals that have already recovered, that actually directly attack the virus and jumpstart your immune system. And then we know that some individuals with COVID-19 actually get really sick because their immune system over-responds. It's overactive. And there are medicines that actually can help calm that overreactive system. If you, like me, want to follow how these drugs are being developed or where they are in the clinical trial process, you can go to your favorite search engine and really just type in COVID-19 treatment tracker. There are a handful of groups like the Biotechnology Innovation Organization or the Milken Institute or the New York Times that list these COVID trackers that really give you a sense of where the progress is. We do not have nearly as many treatments as we would like. That's one of the frustrating things about being in science is watching things go through the clinical trial process. And sometimes it feels like they move incredibly slow, but we are making really important progress. And it's part of why fewer people who get sick and find themselves in the hospital ultimately have to go on ventilators or pass away, because we do have better treatments. there is clear evidence that COVID-19 is not an equal opportunity player when it comes to communities of color. So I'm showing you a graph, and this is information that was published by the CDC a few days ago, and it actually shows you the risks of different ethnic or racial groups, the risk of them of becoming a case, of getting infected, of being hospitalized, or of dying. And the key components, especially for those of you that might be listening on the radio, in communities of color, African-American non-Hispanic individuals are being hospitalized at almost 3 times the rate of white non-Hispanic individuals, and have almost twice the rate of deaths compared to white non-Hispanics. And those hospitalization and death rates are even higher for individuals of Hispanic or Latino background, and even higher again for individuals who are American Indian or Alaskan Native. So race and ethnicity are their markers, they're risk markers. There is not something inherent in our genetic information that gives people of color a higher risk of becoming seriously ill. But we know that many people of color actually find themselves either having a higher percentage of underlying conditions, that big table of different disorders that I showed you a few slides ago. So as a population, they're at a higher risk of more serious symptoms, or they may find themselves in jobs that require them to have a higher exposure. Maybe they're frontline workers. Maybe they are working in places where they're more likely to come in contact with the virus. So their risk of exposure is automatically higher. Or they may have less access to medical care, or an understandable distrust of the healthcare system. So they may have less of a connection to a physician or to a healthcare setting. Regardless, this is an inequality that we have to address, that communities of color find themselves at higher risk of serious illness or death. And I think Dr. Perry will probably speak a little bit more into that. Okay, let me quickly transition to variants, because you may have heard a lot about there are these different variants. I'm showing you on the screen a map of the genetic recipe of what we'll call the classic version of the virus, that which was prevalent, say, before last November. And there's a little picture of the virus, and then there's an outer circle, almost like a donut, and that represents the genetic recipe of the SARS-CoV-2 virus. Just like a cooking recipe, changes to the genetic code can change the final outcome. So for example, one of the variants you may have heard a lot about is called B.1.1.7. You may know it as where it originated from, the variant that was first identified in the United Kingdom. And on the picture I'm showing you on the screen, I'm also showing you that genetic recipe. It looks like that circular donut with a whole lot of lines coming off of it. Each one of those lines is a specific place in the genetic code that has changed in this version of the virus, this variant. And then again, there's another variant that was first identified in populations in South Africa, and that's called B.1.351. Again, the specific names aren't that important, but what is important is that they have genetic changes. You can think of this as the difference. For example, my mom makes banana pudding, but she makes the warm banana pudding with a meringue topping. My mother-in-law makes a cold banana pudding with a whipped cream topping. And my daughter-in-law makes a banana pudding that actually uses Cool Whip and doesn't use vanilla wafers, but actually uses ginger snaps. So those are different recipes that actually have slightly different final products. The same is true of these variants in the virus. And the challenge is that the variant that was first identified in the United Kingdom and the variant that was first identified in South Africa have specific changes. I'm highlighting a couple of the important ones, and these changes make it easier for the virus to attach and get into human cells, so they make it easier to spread infection, or in some cases, they make the antibodies that our immune system produces less functional, less effective. So if I gave somebody the plasmid from someone else that had had the classic virus, and they had the variant that was identified first in South Africa, some of those antibodies in the plasma may work less effectively. It doesn't mean the medications don't work at all, but the variants change how well our bodies respond. And that then brings us to the last point, which is vaccines. So I'm going to move through this quickly because I know we've got an entire session dedicated to vaccines. There are 2 vaccines that currently have been approved for emergency use authorization by the Food and Drug Administration, by the Pfizer-BioNTech vaccine and the Moderna vaccine. And I'm showing you on the screen some information about them. They're both mRNA vaccines. They contain a little bit of mRNA genetic code that tells our cells when we get vaccinated to produce a little bit of the protein that sits on the outside of the virus, the spike protein. And so our cells produce this spike protein and our immune system says, hey, that's different, and builds an immune response against it. So that if we do get infected with the actual virus that also has those spike proteins, our immune system immediately recognizes it and can neutralize it. You can see that the Pfizer vaccine is authorized for individuals 16 and up, the Moderna for individuals 18 and up. They're both 2-dose vaccines, 3 weeks apart for Pfizer, 4 weeks apart for Moderna, and they're both incredibly effective at preventing symptomatic COVID. And those effective values are equal across ages and different racial and ethnic groups. So those are the vaccines available that we are currently getting into people's arms. This Friday, the Food and Drug Administration will review an emergency use authorization for the Johnson & Johnson vaccine. It's a little bit different. It doesn't use mRNA. It actually uses a modified different kind of virus, an adenovirus. That's not important for this storyline, but it does something similar. It helps the body to recognize the spike protein and build an immune response. If it's authorized, it'll be available for people 18 and up. We are likely not to see vaccinations for teenagers until later in the summer once they go through clinical trials, and children probably even later than that. The Johnson & Johnson is 1 dose. That's a huge difference. You only have to come in 1 time for the vaccine. And the other important piece is that on the surface, it looks like it's got a lower percentage, 66% effective against moderate COVID-19. And that really varied from region to region. It was a little bit less effective in South Africa, in part because of that variant we just talked about, more effective in America. But I think the most important piece is not focusing on that 66%, but focusing on what comes after that, which is that it's 85% effective against severe COVID-19. So it's much more effective against the serious cases. It probably moves people who would get serious COVID down to a mild or a more moderate form that doesn't require them to be hospitalized. So it gives you protection. And there were no hospitalizations or deaths among those that were vaccinated in the clinical trial. So before we get too fixated on 94% versus 66%, I want to make sure we recognize that all 3 vaccines do their job of keeping people out of the hospital and keeping them alive to have more birthdays. Now, having said that, there are some key questions that we still don't fully have about the vaccines. And I want to be clear about that. And I just lost my slide for that. So let me just, there we go. Let's see if I can do that this way. Always something. Do vaccines prevent the spread of the virus or just protect against serious illness? We're beginning to get more and more information that they not only protect against serious illness, but they also protect against transmission. That is great news because it means if you're vaccinated, not only will you have much of a lower risk of getting sick, but you also are much less likely to pass it on if you come in contact with the virus. Will they be effective against the current variants? It looks like they will be, although they might be slightly less effective in the case of the variant identified in South Africa, and maybe a new variant that you may have been hearing about identified first in Brazil. That doesn't mean they aren't effective. It may mean they're slightly less effective, and even less efficacy is better than no efficacy. How long will their protection last? We know already that we're at the 6 to 7 month window because that's how long it's been since people got their first doses. In some cases, it's more like 8 or 9 months. Can they be given to children? Not yet. The clinical trials are now in process. Can they be given to pregnant or nursing women? that also is really an issue. We know that pregnant women are at a higher risk of serious complications from COVID, but we don't have enough data to say, yes, pregnant women should take the vaccine. That's really a conversation between a pregnant or nursing woman and her physician. And what's their long-term safety profile? And this is probably what you've heard the most in terms about vaccine hesitancy around. When we look at all different kinds of vaccines, we see most of the challenges and complications within the first 6 weeks of vaccination. We don't have a lot of evidence that suggests that vaccines have problems months and even years later. So we've got that body of evidence from other types of vaccines. We also see that with these vaccines, the people that have been vaccinated across the world in December and January and in early February, the safety profile is quite high. There is fever and chills and pain at the injection site in a fair percentage, about half of the people. They don't feel good for a day, but that generally disappears. The second, within about a day, the second dose is sometimes worse than the first, and it's sometimes worse for younger people, not for older people. We see a small percentage of people that have serious side effects, like the risk of anaphylaxis, like where you would need an EpiPen. Those are those are a serious risk factor, but it looks like they happen in about 4 or 5 cases out of every million vaccines. So I don't want to minimize those risks, but those are very, very rare. But still, we don't have that long-term safety profile. And I think that's why people understandably have some hesitation or some caution about being vaccinated. So I'm going to stop there because I've gone on way too long. And Dr. Ezell, I will turn it back to you to move on to our next speaker.
Thank you so much, Dr. Lamb. We're taking some community-based questions. They're coming in as we're going live. We received some questions over the last few days and week. I want to ask a quick question as a follow-up. Dr. Lamb, thank you so much for speaking to whether people of color experience more severe symptoms than others. That's an important question that came in, but what is herd immunity and are we there yet? That question came in, and if you could quickly touch that.
I sure can. Great question. Herd immunity is the concept that enough people have immunity that if the virus is present, it has a really difficult time finding someone that it can infect. So it's all about reducing the likelihood of finding someone that the virus can infect. And you can get herd immunity by one of 2 ways. Either you've already had COVID-19 and you've recovered, so you've got natural immunity, or you've got immunity from a vaccine. We are not there yet. Exactly how close we are is actively being debated and discussed, but we are not at a point where enough people have either already recovered or have been vaccinated to reach that level of herd immunity. There are still lots and lots of us that are available targets for the virus to infect and then jump on to somebody else.
Thank you so much, Dr. Lamb. I want to switch gears. Ms. Price, want to raise the question, since combating COVID-19 is everyone's responsibility, what are useful ways that youth and adults may protect themselves and their family?
Thank you so much, Dr. Ezell. Let me go ahead and share my screen. Let me know. Hold here. I'm having a little technical difficulty here. Bear with me. I'm in between screens. I apologize for this. Okay. Let's see. All right, can you see my screen now?
No, we don't, Daisy.
Okay,
We don't.
I'm on the way. You would think after all this time we would have it done, right?
You've done a few of these, haven't you? Now we can see it.
There we go.
I know. All right. So thank y'all so much. I appreciate that. So we're going to take a few moments to discuss COVID prevention. and some ways that we can do our part to protect ourselves as well as our family and our community. When we start thinking about ways that we could slow the spread, it is important for us to consider that we need to minimize how droplets are going to be shared within our family as well as with others. Facial coverings and masks have been proven to slow the spread. So facial coverings need to be worn over the mouth and nose to make sure that you're minimizing transmission of respiratory droplets. Along with facial coverings, you want to maintain a 6 feet physical distance when you're interacting with others. This also helps to reduce transmission of respiratory droplets. Washing your hands with warm water and soap has been proven to minimize the transmission. You want to specifically make sure that you are washing your hands when you have been in public. If warm water is not available to you, using a hand sanitizer that contains at least 60% alcohol is effective. Be sure to cover your mouth and nose when you're coughing and sneezing, and use your elbow or tissue if they are available. After coughing and sneezing, make sure that you wash your hands as well. Lastly, we can't stress enough that it's important to make sure that you're cleaning high surface areas. So those areas that we're touching a whole lot of, making sure that those areas are cleaned often. For many of us, I'm sorry about that. For many of us, we live in multifamily as well as multi-generational households. So we're in homes where some of us are leaving to physically go into work, while others of us are staying in the home and working remotely. While we have students attending schools in a variety of ways. Sometimes they're in person, sometimes they're hybrid, and sometimes they're remote. With those cases, we need to think about additional precautions. You want to make sure that you're bringing in fresh outdoor air as much as possible. If there are ceiling fans in the home, adjust those ceiling fans to make sure that air is being pulled up. And the way that you know that the ceiling fan is pulling the air up is that the ceiling fan should be rotating clockwise. So if you're standing beneath the ceiling fan, you should be able to look at it from any position and know that it's rotating clockwise. If there are standing fans or floor fans in the house, make sure that they're pointed away from others. You want to minimize your interaction with others as much as you can with people that are not in your households. And when we have to go out and get the essential things that we need, if at all possible, consider purchasing a 2-week supply, because that will minimize our activity with larger crowds. Now, if we find ourselves in a situation where we're in a multifamily or multi-generational household, and someone in our house has been exposed, they show symptoms, or they actually have COVID-19, what are some things that we need to be doing? One of the first things that you want to think about is the healthiest person or the person that is considered low risk should take on the role of being the caretaker in the household. Those individuals that have been exposed should quarantine or isolate themselves should you have space permitting. You want to make sure that you're wearing facial coverings at all times except for when you're sleeping. Regarding sleeping, if you can sleep alone, that is really important. But if you find yourself in a place where you can't, space is not permitting for you to sleep alone, some things that you can do is, if you're sleeping in the same bed with someone, you want to sleep head to toe. Consider hanging a curtain or a cardboard wall between you and that individual. Opening up the windows to make sure that fresh air is coming into the bedroom. And I realize that we're in the colder months, so opening up the windows may be a little bit challenging, but make sure that you keep the doors open. The goal here is to think about making sure that air is circulating in the bedroom. When it's time to eat, you want to make sure that you're eating in a place where you're away from others. Consider eating at different times than everyone else in the household. You want to avoid sharing dishes, drinking glasses, cups, and other eating utensils. For the caregiver that's in the house, being mindful that when you're cleaning those high touch surface areas or you're cleaning those spaces, that the individuals in the household have been exposed, make sure that you're wearing gloves because we want to keep the caretaker safe as well. Now let's talk a little bit about wearing gloves. Are wearing gloves a necessity? Yes, they are when you're the caretaker. When you're the individual that's taking care of those that have been exposed, that show symptoms, or that have COVID-19, it is an extremely good practice to make sure that you're wearing gloves. When you're outside of the role of a caretaker, wearing gloves is more for your personal comfort. Now, if you're wearing gloves as a reminder to yourself not to put your hands in your face, then gloves are probably a good idea for you. But if you're wearing gloves in an effort to try to minimize transmission, you can simply wash your hands with warm water and soap, and that'll do the job. And even if you're wearing gloves, make sure that when you take the gloves off, you're washing your hands. Now, we've covered a lot of content in a short amount of time. What's important for us to know is to take away a few things here. Being intentional about searching for ways to minimize the risk of exposure to ourselves as well as our family. Our goal here is to make sure that we're playing our part. If you find yourself not being able to do all the things that we talked about here, that's okay. If you can incorporate one or two of these things, this will help minimize the risk for yourself as well as those that you love. Dr. Ezell, I turn it back over to you.
Thank you so much, Ms. Price. Let me ask a quick question that came in earlier in the week. Is there a certain type of mask that we should consider?
Yes, cloth masks have been shown to make sure that the risk is being minimized of spreading.
Okay. So just
Dr.
generally,
Zell, if I can just jump into that,
Mhm.
the best mask is the mask that fits you well, that
Mhm.
doesn't have a lot of gapping and that you're not continually pulling at because it's uncomfortable. So, yes, N95s are the top of the line, but there aren't a whole lot of those available, and those really need to make sure that we get those to healthcare workers. So the white surgical mask, cloth mask, as long as they fit and there's not a lot of gapping, some folks even double up on those masks.
I'm glad you hit on the double up piece. That was another part of the question. The person said, should I double up? So that's very helpful because we see a lot of that today on television with a lot of folks who are doubling up. Thank you so much, Ms. Price, with regards to COVID-19 prevention. I want to switch gears because now we're at a space where the healthcare community and community of colors, in a sense, are going to have to work together, coexist together in an effort to, one, slow the spread, but most importantly, to make sure that we all stay alive. I want to switch gears to Dr. Perry. I want to ask the question, given the current racial tension in the nation right now, cultural competence has emerged as a critical skill for healthcare workers during this pandemic. Help us to understand why some African Americans and other minority groups have mistrust towards the U.S. medical community.
Oh, good evening, Dr. Ezell and everyone out in the virtual world. I thank you, Dr. Ezell and HudsonAlpha for inviting me to be here. And thank you to WJAB, Alabama A&M's own radio station, for covering us tonight. So let me share my screen. Oops. Okay. So we're going to talk a little bit about mistrust. And what we've seen is that Black and Indigenous people of color, oops, I am so sorry. Let me exit out. And so what we've seen is that Black and Indigenous people of color, both nationally and within our state, have demonstrated a mistrust of government-sponsored health entities. And we've actually observed this nationally as it relates to the vaccine. The Pew Research Center is showing that and reporting that nearly 40% of Americans are saying that they will not or probably will not take the COVID vaccine when they have an opportunity to do so. In addition to that kind of national research, we also have some research that has been afforded to us through Representative Hall. And it's actually the only kind of research that we have related to COVID intentions and attitudes in Alabama. And so the COVID-19 vaccination survey was conducted by Representative Hall, by Mr. Patrick Grayson of KGA Strategic, and the period of performance that was covered with the survey was from the 13th of December 2020 through this month. And the methodology was a hard copy survey as well as a Google survey. Approximately 1,000 people participated in the survey. And what the survey found is that approximately 22% of the respondents reported that they would not take the COVID-19 vaccine when made available. This is important given that the majority of the respondents were Black, Indigenous, people of color, and that these people had observed, 93% of these people had either reported that they themselves had experienced COVID-19 or they had come into contact with someone who had the virus. And we see that what contributes to the mistrust that we're seeing nationally and within Madison County is related to a number of issues, but they include a lack of culturally competent information regarding the vaccine. Also, there's a lack of longitudinal data regarding the long-term efficacy and the side effects of the vaccine. And then one factor that's very important is this history of discrimination and marginalization. And so what we see is that as a community, we are sick and tired. And you know, Fannie Lou Hamer once said in 1964 that she was sick and tired of being sick and tired. Well, we are sick and we are tired. As Black, Indigenous, and people of color, we have historically borne a disproportionate burden of illness. And Dr. Lamb talked about this earlier. We have borne a disproportionate burden of illness, hospitalizations, and deaths during all public health emergencies, including H1N1 and the Zika virus epidemic. In addition, we suffer disproportionately from a number of illnesses, predisposing illnesses, you know, including type 2 diabetes, hypertension, heart disease, obesity. And so for many of us, COVID-19 is just one more burden, and it's one more burden that's making us sick, and it's really taking us out. What we find is that the burden of illness is linked to structural inequalities. There are these social determinants of health. And so what we find is one of the most defining structural inequalities is actually income and income disparities. There was a recent article that was published out of Harvard and in the Journal of Social Science. And what it is indicated is that if reparations have been paid to the descendants of enslaved African Americans, that these income inequalities, which then lead to inequalities in terms of access to health, access to education, access to general wealth, because we inherit wealth, would have actually dramatically decreased the level of COVID-19 transmission that we're seeing. And so we see that these social determinants of health actually impact these disparities that we see. And so I think what we're seeing in terms of the mistrust is that we are sick and we are tired. We're tired of our lives not mattering. We're tired of being sick. We're tired of dying from multiple illnesses, from police brutality. We're tired of grieving, and we're tired of suffering. And so I really think that the mistrust that we're seeing in our communities is just as much a reflection of our weariness as it is a lack of trust in the systems that have failed us. Thank you.
Thank you so much, Dr. Perry. In following up, in thinking about, a path forward beyond the mistrust, because, we're dealing with not only, vaccine hesitancy, there's also the term now vaccine alarmism. Folks are raising questions. How in the world did this vaccine, come about so quickly, on another side? But a way forward, what steps must be taken to really better engage minority communities around vaccine education? If we're going to kind of open up a pathway, to kind of move forward and connect, best practices that you've seen in your work that could really support better engagement to minority communities around vaccine education.
That's an excellent question, because we may be sick and we may be tired, but we are overcomers. We are survivors. And so I believe that guided by our faith and driven by our faith, as we have always done, our communities have a history of doing the impossible and making a way out of no way. And so we have this legacy of overcoming that compels us to act. And so I think as individuals, we have to arm ourselves with COVID-19 knowledge, like Dr. Neal gave us tonight, in terms of the science of the virus. And Ms. Price gave us those prevention strategies that we can practice, but we have to know the science behind the vaccine. We also have to equip our families and our networks with COVID-19 facts. We need to practice COVID-19 prevention strategies, and we need to make an informed decision about taking the COVID-19 vaccine, and also encourage our families and our networks to do so. In being transparent, I have to say that I early on had decided that I would not take the vaccine, the COVID-19 vaccine, and that was based on a lack of science that I believe that was available, and some mistrust that I had. And remember that our mistrust is based on a history of being marginalized. And so I had made that decision, but the more I educated myself and looked at the facts, and if as a perfect person of African ancestry, if I am 3 times more likely to be hospitalized if I get COVID, and if my chances of dying from COVID-19 increase exponentially because of my ancestry and all of those pre-existing issues, one of which I have, I kind of looked at that, and then looking at the data that Dr. Lamb shared with us in terms of the efficacy of the virus, I had to kind of weigh that and make a decision that was best for me and for those that I love and care about. So next week, I'll be taking the second round of the vaccine. And so I encourage people to make a decision based on the science, and make a decision with your life and the lives of those people that you love in mind. I think going forward as a community, we really need to enact a broad-based coalition in terms of prevention and response. And that is a coalition that is inclusive. And I'm talking about grassroots organizations, neighborhoods, of course, the medical sector, our faith communities, but all of us coming down to sit at the table and talk about a way forward and how we can best use messaging that is culturally relevant to reach people in our communities. And then we also need to take advantage and enlist the support of representatives like Representative Loral, Anthony Daniels, and others as we work toward policies, putting policies into place and addressing existing structural inequalities. Because until we do that, health disparities will not go away, but we can be successful because we are overcomers. And so I think that that is possible, but all voices need to be heard.
Thank you so much, Dr. Perry. Dr. Myers, I want to pull you in. I saw your hand up.
Well, first of all, thank you, all three of you. Dr. Perry, I'm glad to meet you. I've not met you before. It's great to hear your comments. And I think these are some of the most pressing issues, not just for COVID, but for everything, really. I was actually raising my hand to see if I or Neil or any of you answer one of the questions that showed up about, should we trust the vaccine since it happened so quickly? And I'd like to just make a statement about that. I hope it doesn't sound patronizing. I certainly don't feel that way. I don't have ties to the vaccine makers at all. But it really does usually take years and years and years. It's a really hard thing to do, and especially to know whether it's safe. That's the first thing they do once they try to develop it, and then to know whether it works. If it is, what about the efficacy, as they say? And how could they possibly do this? And it's one of the first times maybe that all of these companies and scientists from around the world, academic scientists always share information. Companies sometimes, not always, don't share it as much, but everybody dropped everything, or not everybody, these companies dropped everything. And that's basically, I mean, you take, I don't really know the numbers, but I'm sure Pfizer has many tens of thousands of employees, and they didn't stop working on whatever drugs or whatever the other things they work on, but huge numbers and lots of collaborations with academia, because everybody realizes this is a serious crisis. And it's been horrible. It could be a lot worse. It could have been a lot worse. So to me, that didn't make me I think it's a good question. Should I trust it? Because did they cut corners? They did not. I do not believe for a second, looking at all the data, Neil, I think, would back this up because he's read and looked at this really carefully, that they didn't cut corners on safety and efficacy. They didn't know a few things like, does it prevent the spread? They actually know that now, but they weren't able to do that during the development of the vaccines because they needed to hurry up and check those other two things first. Did I get that right, Neil? Is there anything to add to that? I think that
you did, Rick. I think that while Operation Warp Speed is politically a great name to, score political points, it's a horrible name for the rest of us because it implies that everything moved so rapidly, and we often equate speed with mistakes or with errors. An important part of what Operation Warp Speed was about was it provided funding so that drug manufacturers, vaccine makers could go on ahead and make the vaccine, production level vaccine, while they were still in clinical trials. So the federal government took on the risk instead of saying to the company, you have to wait until everything's been approved and then you got to figure out how to ramp it up. So they did things at the same time instead of doing A and then waiting and doing B. But yeah, you're right, Rick, but the wording has caused so much angst, and I wish we would have come up with something other than warp speed for this, to title this vaccine effort.
I want to pick up with a question that came in and then handle one of the questions that's in the box around prevention, vitamin D and what have you. But this question that came in, it's not an issue of not wanting to take the vaccine. I can't seem to get it. I'm over 65 and Black, and it seems like whenever I call or go, they say I can't get it. My white friend was able to get hers the next day, but it seems harder for the Black people. It seems like they are rationing or hoarding vaccines. This goes back to the conversation around race, health, mistrust. It may be a process issue. It's something. Could someone speak to that I'm sorry, go right ahead. Dr. Perry, I see that you're trying to jump in on that. I'm sorry.
Oh, I'm sorry. I know I'm just, I'm shaking my head because, you know, we're talking about context, and context matters. And all of those historical issues that factor into, and it's mistrust, it's based on history. So whether or not the person that submitted the question was actually discriminated against in some way, we have that thought because of the context, right? And when your life, because your life matters, and she's not been able to access the vaccine, it's very personal. It's very difficult. It's very difficult. And I can't speak to the systemic issues, but we know about healthcare access as well. Those are issues.
Rick?
Well, I was just going to comment that may well have been discrimination, but it also could be the whole response nationwide has been haphazard. And I think we're just trying to get, I mean, I've heard this story from hundreds and hundreds of people about that, not being able to get the information. You know, it'd been great if there was one web page one web-based thing where everybody could go, and then you know what's going on. It's very, very frustrating. The good news, and right now, I think it's availability of the vaccine. It's also the logistics. It's really hard to do this, and I think there are some states or even cities or towns who are doing it better than others. We need a national response to try to make everything sort of systematic, so that you don't have this. There are some places where they're doing better. I mean, interestingly, you might have read Birmingham has done extremely well with. It's really not just UAB. I think it's all the groups in Birmingham have done extremely well with African American groups. Better, in fact. Better than any other city in the United States, which is, you know, I'm, but that's one, and then you move over to the next one, and then it seems haphazard. So I think the good news is I think we are starting to improve with the supply. At least we hear that. I think the storms last week just helped to wreck what was looking like a good ramp up. The problem is I can say that now, and then 2 days from now, I might say something different because you know, it's kind of all over the place. I don't want to point fingers or blame. I don't know who's to blame for it. I think we just need to, and we need to get everybody vaccinated. We need to do as much as we possibly can to get herd immunity.
I want to pull in. Thanks so much, Rick. I want to pull in one more question. If Ms. Price and Dr. Lamb could engage this one. It centers around persons with underlying issues who wish to take vitamin D, vitamin C, zinc, melatonin. Are those helpful, you know, preventative tools if you decide to, you know, take a vitamin C dose or echinacea, what have you? So there's a question in the box around helpful and preventative tools that we're not hearing about, you know, in media, but we're hearing a lot about the vaccine, but not a lot about preventive care or preventive medications that you can get, you know, over the counter or what have you.
I'm happy to start with that, and then Ms. Price, if you want to jump in after me. So this is challenging, and I don't say that to try to sidestep the question. There have been several small studies that have looked at our vitamin C, vitamin D, zinc, are they effective in reducing the symptoms? And part of the challenge is you need a really well-controlled trial to tell that, because the vitamin C that you take from the grocery store may be different than the vitamin C that I take. There are differences in how severe our illness might have been, if I have underlying conditions and if you don't. So you need to really do this in a way that lets you try to eliminate or at least control for all of those different variables. And you need a fairly large study to be able to do that. So I've seen a handful of small studies that have said, yes, this is effective. And I've seen an equal number of studies that say, no, it is not effective. And that becomes very frustrating because it's easy for us to then follow a narrative of, well, it really is effective, but nobody wants me to take this because they want me to spend $1,000 on this other more expensive medicine. So they're hiding the fact from me that this is an effective medication. And it comes back to the narrative that Dr. Perry talked about in trust. If I think that someone is trying to keep something from me and force me to take a different choice, I'm going to look at this with a different set of lenses. I wish that there was data where I could point you to that says, yes, this works. And I know somebody's going to say, well, this blog that I read or this article that I follow says this works. And yes, I can find that study. I can find an equal number of studies that say no. We just need much, much larger, well-done studies, but it isn't something that people are willing to fund. And so we're left with this, well, I feel like it should work. Why doesn't it work? My neighbor took it and he felt much better. But I come back to, what does the science tell me? And right now, I don't have any evidence that, yes, we should be taking these things. They don't hurt you, but I don't have a whole lot of evidence that they're going to be beneficial.
And that's true for lots of things, not just COVID, for years, zinc, all of those things for common cold, et cetera. They don't hurt you. But do be careful. Don't take mega doses of any vitamin or anything, because those are harmful. So you can do the minimum daily, the amount that is recommended, not minimum, the recommended daily allowance, and then some. But don't take mega doses of vitamin D, of anything, even vitamin C. But certainly some of them can be harmful. So that I take them, doesn't hurt. And I also, Neil, I think the important thing that I've been reading about this a bunch for other reasons as well, is they probably don't prevent. They may help some if they help if you have something and it helps to maybe minimize it some, maybe. I'm only saying maybe, but there really isn't suggestion that they're going to prevent. So
we certainly know that vitamin D boosts your immune system.
Yeah.
And so anything you can do that boosts your immune system, we should be doing it, whether that's being out in the sun, taking vitamin D, drinking a lot of milk, whatever. But can it prevent it? I think is a question that we don't have the data around. So Rick, thank you for that clarifying point.
Ms. Price, any thoughts?
Yes, I can just echo what Dr. Lamb and Dr. Meyer said, that if it comes down to a place of comfort, they don't hurt. Having vitamins as a part of a healthy diet and what you're eating is extremely important. So it's not just about taking vitamins, but making sure that you're exercising, getting vitamin D, doing the things that nourish you physically, mentally, spiritually. All of those things can help. But if you're thinking about it from an immunity standpoint, vitamin D and vitamin Z and zinc, they wouldn't hurt.
Thank you so much, Ms. Price. At this time, we'll go ahead and round it out. This has been a really good discussion. One of the things we want to do at this time, if we can get final thoughts, closing thoughts. I want to start with Dr. Myers. Any closing thoughts you have?
No, other than just to say thank you for doing this. I think the science it's our job to report and talk about that. Neil and Daisy and the whole education outreach team, as well as some of the other science, wonderful job. Dr. Perry, I'm so glad that we have you on for all the things that you talked to us about. I think this is a good way to at least make a dent in it. I hope we're helping. And if you have suggestions on how to help, please let us know. Remember, we're having another one on March 9th, is that right? And there'll be other additional topics, but I think this is really important. Thank you, Dr. Ezel, for arranging all this as well, and as well as the rest of the team.
Dr. Lamb?
I would just say, I know that we are tired of wearing masks and thinking about, can I go to the restaurant with my friends? I want to go to the gym. I want to gather and hug people, and I want to be in large church gatherings. I know that you are tired of that, of not being able to do those things. I am tired of not being able to do those things. We will not always be in this situation. We are seeing improvement. We are, though your actions make a difference. The things we do today impact what next month looks like for our community. So I would say just hold fast. We are we are seeing improvements, and this is not the time to take off our mask and run wild and hug random strangers. That would not be a good idea at this point. But at some point, you probably can do that, just not right now.
Ms. Price.
Yes, I know we're tired. We've been doing this a lot longer than we anticipated, but doing your part, making sure that you are doing things to minimize your risk, to protect your family, your community, and your friends will help. It really does. Just even when you think about that, you know, I can't put this mask on one more time, or I jump out of the car and realize I get to the door and I see a sign and I got to come back and it won't be long that we continue to do this, but just think about the why that you're doing this, the family that you come back home to, the family that you want to see. Put your mask on and make sure that you're maintaining physical distance so that you can get to do the things that you want to do.
Thank you so much, Ms. Price. And Dr. Perry.
Dr. Ezel, I want to thank you for convening this conversation. It was a pleasure to meet you, Mr. Myers, and Dr. Lamb and Mrs. Price. This was an important conversation. Again, I believe that we are overcomers. All facets of the community came together this past summer it was really a dramatic kind of social movement that occurred, bringing allies and all sectors of the community together to do what needed to be done, and we can do it again. And so make some decisions that are important for the survival of, you know, yourself as an individual, but also of your family and the community.
Thank you so much. Thank you. We want to thank our roundtable guests, Dr. Myers, Dr. Lamb, Ms. Price, Professor Perry, who had a chance to hang out with us tonight to answer some real serious questions. Some of the questions that are in the chat box, we didn't get a chance to touch on. Some are related more so to the vaccine. Keep in mind that we have another roundtable that's coming up in a few weeks. We'd like to acknowledge WJAV, Mr. Elvin Jenkins, who's the Director of Electronic Media Communication, and his staff at WJAB and also WJAB TV for partnering with us tonight to simulcast this live roundtable discussion. We had a chance to really engage a broader audience through that connection. So thank you so much. Now, it's our hope that this roundtable discussion will really serve as an educational resource and tool for the larger community. We say the larger community for Huntsville, Madison County, North Alabama, the state of Alabama, and anyone within the sound of our voices tonight. We want you to use this. So please visit HudsonAlpha.org/DEI. You can go there tomorrow morning and you can download this video. We hope that you share it with your friends, your family members, your community allies. In addition to that, you can also register for the next roundtable tonight. If you look in the chat box, you'll find a link in the chat box to register for our next event, which will take place on Tuesday, March the 9th at 6 p.m. It will explore vaccine basics, mistrust, and community mobilization. We look forward to welcoming our guests for that event, Dr. Milton Brown of George Mason University, Dr. Candace Fenella of HudsonAlpha Institute for Biotechnology, and Mr. Kenny Anderson with the city of Huntsville. And also, I'm gonna go ahead and say, Rick, come on and hang out with us as well, because this is gonna be a good discussion in roughly about 2 weeks. So for those of you all who had a chance to visit with us this evening, thank you so much, and please, please stay safe. Thank you.